Evidence in detail. Previously, we introduced you to professional resources to find evidence, reference materials, scholarly journals, and systematic review. There are so many journal articles, but they are not all designed equal. In fact, there is a general hierarchy. In this pyramid, the higher you go, the better. The specific level of a study depends on the methodology. As a general guide, higher levels have more stringent scientific methodology. The lower levels are less robust and objective. To sum up, systematic reviews followed by randomized controlled trials are best for supporting clinical decisions. Let's look at each level. Practitioners and professional associations provide background information or theoretical frameworks. Encyclopedias and handbooks are also good sources of basic concepts and industry standards. If you're asking, where can I get an overview or the best standardized practices for this topic, start with these resources written by experts. Qualitative studies are based on a smaller population and provide descriptive, not causality evidence. Sometimes for rare diseases, exploratory case studies provide insights that are different from quantitative studies. It's also a more holistic approach that examines different interactions. Looking for answers to what are some socioeconomic or personal factors that affect your patient's quality of life? If you need to research patients' experiences and impacts, look for qualitative studies. Cohort studies are like long-term observations or studies of a large population. They don't intervene or provide treatments. Need evidence on how your patient's conditions may behave over time or how widespread this problem is? Cohort studies investigate links between risk factors and health outcomes. Everyone in an RCT is randomly assigned to a control or experiment group to test the effectiveness of a treatment, therapy, or medication. For a more rigorous RCT, we use a double-blind study to reduce biases. Neither the doctors administering the treatment nor the patients know who's receiving the treatment. It's commonly used to see if a new intervention is more effective than an old one. Systematic reviews synthesize evidence from relevant research and provide clinical recommendations. Now you know about different levels of evidence. Rarely would one single article be sufficient to answer your clinical question. Just know that even the highest level of evidence may have varying outcomes depending on your patients and their clinical settings.